Picture this. You wake up, rub your eyes, and ouch, they're red, itchy, and crusted shut. Sound familiar? You might be dealing with pink eye or conjunctivitis, a common eye condition that can make your mornings miserable. But don't worry, we're here to break it all down for you. Pink eye happens when the conjunctiva, that thin, clear layer covering the white of your eye and the inside of your eyelids, gets inflamed. The result? Eyes that look pink or red, feel gritty, and might even tear up or ooze discharge. It can strike anyone, babies, kids, adults, you name it. In fact, conjunctivitis accounts for about 1% of all primary care visits in the United States, and allergic conjunctivitis alone affects up to 40% of people. While pink eye is usually not a big deal and often clears up on its own, it can be super contagious. Think of it like the common cold of eye conditions. That's why understanding it matters. In this video, we'll walk you through what causes pink eye, who's at risk, how to spot it, and what you can do about it, all in a way that feels like a chat with a friendly eye doctor. Ready? Let's dive in. So what sparks pink eye? It's like your eye's protective shield. The conjunctiva gets attacked, and the culprits vary. Let's break it down into clear categories. Infectious causes are the heavy hitters. First, there's viral conjunctivitis, often caused by the same viruses behind colds, like adenovirus. It's highly contagious, spreading through touch or shared items. Then there's bacterial conjunctivitis, triggered by bacteria like Staphylococcus or Streptococcus. This one's also contagious and often comes with thick, gooey discharge. Allergic conjunctivitis is another big player, especially if you're sneezing through spring. It's caused by allergens, pollen, pet dander, dust mites that make your eyes itch like crazy. Unlike infectious types, it's not contagious and usually hits both eyes. Up to 40% of people deal with this, especially in allergy season. Other causes include irritants like smoke, chemicals, or even shampoo in your eyes. These are like a one-time punch to the conjunctiva, causing temporary redness. In newborns, a blocked tear duct can lead to pink eye, trapping tears and inviting infection. Rarely, serious infections from sexually transmitted diseases can cause it in babies during birth, which needs urgent care. Ever wonder why some people get pink eye more than others? Certain factors make you more likely to deal with it. Let's look at what ups your odds. For infectious pink eye, close contact with someone who's got it is a big risk. Schools, daycares, and crowded offices are like playgrounds for viruses and bacteria. If your coworkers rubbing their red eyes, steer clear. Touching contaminated surfaces, like doorknobs or shared towels, can also bring it on. Allergic pink eye hinges on your environment. If you've got allergies, pollen, or pet fur can set off a reaction. Living in a pollen-heavy area, your risk climbs. And for contact lens wearers, improper lens cleaning or wearing them too long can irritate your eyes or trap bacteria, making both infectious and irritant pink eye more likely. For newborns, the risk comes from the birth process. If mom has an infection like chlamydia, the baby might pick up a serious form of pink eye during delivery. Environmental factors like air pollution or frequent exposure to smoke can also irritate eyes and invite trouble. Some risks, like allergies or being a newborn, you can't change. But others, like hygiene or lens care, are in your control. Knowing these helps you stay one step ahead. What does pink eye feel like? The classic sign is redness in one or both eyes, as inflamed blood vessels give your eyes that pinkish glow. You might also feel itchiness or a burning sensation, like your eyes are begging for a scratch. Discharge is another telltale sign. In bacterial pink eye, it's often thick, yellow, or green, crusting your eyes shut overnight. Viral cases tend to have watery discharge, while allergic pink eye brings clear, teary eyes. Speaking of tears, excessive tearing can make your eyes feel like they're overflowing. Swollen eyelids, and in some cases, sensitivity to light or photophobia can add to the mix. Symptoms often start mild, a slight itch or redness, and can worsen over days. Allergic cases might come with sneezing or a runny nose, tying it to your allergies. Pay attention to these signs, but don't panic. They're your body's way of saying, hey, something's up. If they stick around or get intense, it's time to check in with a doctor. How do doctors figure out if you've got pink eye? Your doctor starts with your story. When did your eyes start acting up? Any recent colds, allergies, or contact with someone with red eyes? They'll ask about pain, vision changes, or discharge. Next comes the eye exam. They'll look at your eyes, checking for redness, swelling, or discharge, sometimes using a light to see the conjunctiva up close. They might test your vision or eye movements to rule out other issues. For most cases, this is enough to confirm pink eye. But if things look severe, say you've got intense pain or blurry vision, they might take a sample of your eye discharge. This swab goes to a lab to pinpoint whether bacteria, viruses, or something else is to blame. In newborns, especially if symptoms don't improve, tests for infections like chlamydia might be needed. Treating pink eye depends on what's causing it. For viral conjunctivitis, patience is key. Like a cold, it usually runs its course in 1 to 2 weeks. To ease discomfort, try artificial tears to lubricate your eyes or cold compresses to calm swelling. Keep things clean. Wash your hands often to avoid spreading it. In rare cases, like herpes-related pink eye, antiviral meds might be prescribed. Bacterial conjunctivitis often calls for antibiotic eye drops or ointment. These can shorten the infection and make you less contagious, but you've got to use them for the full course, even if you feel better. Allergic conjunctivitis is all about dodging triggers. Stay away from pollen or pet dander if you can. Antihistamine eye drops, over-the-counter or prescribed, can tame itching and redness. Oral allergy meds might help too. These treatments work fast but need regular use during allergy season. If irritants like chemicals are the cause, flushing the eye with water or saline helps. For serious chemical exposure, get to a doctor as soon as possible. No matter the cause, stop wearing contact lenses until your eyes are clear and toss any disposable lenses you wore while infected. Let's wrap this up. Pink eye, or conjunctivitis, is a common condition that turns your eyes red, itchy, and uncomfortable. Whether it's caused by viruses, bacteria, allergies, or irritants, it's usually not serious, but can spread like wildfire if you're not careful. Good hygiene, timely treatment, and knowing when to see a doctor are your best tools for managing it. From washing your hands to avoiding allergens, you've got the power to prevent pink eye or keep it in check. If your eyes are acting up, don't ignore them. Talk to a healthcare provider to get the right care. Your eyes do so much for you. Let's keep them shining bright.